The bad news is that until recently, no one's been in charge about what a doc prescribes, except in very unusual settings like the Kaiser healthcare system. The good news is that whatever happens in Washington about Obamacare coming or going or being dismantled or strengthened, what is happening is that there is a move toward accountable care organizations in which people have realized that you can't go on delivering health care as a bunch of freestanding widgets with everybody charging based on how many widgets they provide, whether it's a visit or a procedure or an MRI or an operation. We've got to have some better way. Whoever is in charge in Washington and whatever one's politics, we need to figure out a way to organize healthcare so that we have some system that the patient is a part of and not lots of doctors and hospitals and MRI centers all vending their wares, because the marketplace is not fixing that. And so we are inching toward more of this accountable care organization approach where a patient would sign up with a given entity, whether that is a hospital system or a health insurer or some combination of all of the above, and that entity would be responsible for all the inputs and outputs of that patient's medical care. And then there is somebody to talk to about, are you managing your diabetic patients well? Or are you using these new drugs for hepatitis C appropriately? And we are inching toward that, and it seems to have a momentum that is almost independent of what's happening politically about healthcare delivery, because we simply can't afford to go on with the system that we've had before. We're already spending about 18% of the gross domestic product on healthcare. All the advanced European countries are spending, instead of our 18%, somewhere between 9 and 12% of their gross domestic product. And the outcome data are that the patients are just as happy, the outcomes are just as good, and there's just a lot less waste. So we are inching toward trying to look a little bit more like the rest of the industrialized world by having better organization in our healthcare, and that's going to open the door to entities saying we need help in how we're using medications.